let's get to another discussion whereby we have the ethmoid bone. Remember, this is another bone of the cranium. And for the ethmoid bone is unpaired bone and much delicate, and as well the spongier bone located in the anterior part of the cranial floor between the two orbits. It is anterior to the sphenoid bone and posterior to the nossal bones. The ethmoidal bone forms part of the anterior portion of the cranial floor, the thin medial walls of the orbit, the superior portion of the nossal septum, a partition that divides the nossal cavity into right and left side, and most of the superior side walls of the nossal cavity. The ethmoid bone is a major superior supporting structure of the nossal cavity and forms extensive surface area in the nossal cavity. So let's get to the skull. This is much disarticulated skull, and the ethmoid bone is located right there. For the other case, we have the skull, and the ethmoid bone is right here. And we have at least some other identified structures. But for our concern, let's just move to the ethmoid bone. For we have the olfactory foraminers, which is presented right there. Ethmoidal cell of ethmoidal sinuses, lateral mass. Then we have the cribriform plate, have the crista galli, and the perpendicular plate. So this is the superior view of the ethmoid bone, or a view from above. This is the inferior view, and the crista galli, we have it right there. Ethmoidal cell of ethmoidal sinuses. As well, it can be seen from this other architecture of the ethmoid bone. Have the superior nossal concha, the middle nossal concha, which is there. Then we have the perpendicular plate. Okay, the same ethmoid bone from a fused skull, not disarticulated anymore. We have the crista galli, then we have the lateral mass, and we have the perpendicular plate and the middle nossal concha, and these are other structures which we'll be able to find from a description elsewhere. So the same bone, cribriform plate, superior and anterior is up, lateral or the left, which is anterior is to the left. Then we have the anterior and superior is up, crista galli, labyrinth, perpendicular plate. So let's get to the description. The lateral masses of the ethmoid bone compose most of the wall between the nossal cavity and the orbit. They contain 3 to 18 air spaces called the ethmoidal cells. The ethmoidal cells together form the ethmoidal sinuses. The midline perpendicular plate is a flattened lamina placed at the midline between the lateral masses and forms the superior portion of the nossal septum. The horizontal cribriform plate lies in the anterior floor of the cranium and forms the roof of the nossal cavity. For the cribriform plate, roofs the nossal cavity and contains the olfactory foramina through which the olfactory nerve number 1 passes through. Projecting superiorly from the cribriform plate is a triangular process called the crista galli, which serves as a point of attachment for the falx cerebri, the membrane that separates the two hemispheres of the brain. Labyrinth, or the lateral masses of the ethmoid bone, contain two thin scroll-shaped projections laterally to the nossal septum, and the lateral plate of the ethmoidal labyrinth forms the medial orbital wall, and the medial portion, the medial wall of the nossal cavity. So that's all about